Yep, we're live. Okay, tell us your name.
My name's Dr. Susie Harris.
And what kind of a doctor are you?
I'm an applied kinesiology chiropractor and a functional health physician.
Okay, wonderful. And tell us, then do just go ahead and tell us what kind of things you've been seeing.
Well, I wasn't sure what to think in the beginning, just like everybody, when everything was hitting and the vaccines were coming out. And the first thing I saw was families divided, people losing jobs, kids getting pulled out of daycare. Because I have families that I help who have previous vaccine injuries, and so they don't vaccinate anymore. So the mandates really had an issue for them. But once things started rolling out, in the first 3 to 6 months, I would say I saw a lot of digestive issues, a lot of people coming in. One person in particular had their Crohn's under control. They were off autoimmune drugs, and then now it's back with a vengeance.
So is that after taking the shot?
Yeah.
Yeah.
And clots. I have 2 patients who've experienced clots in their legs, and they've had to go through treatment with blood thinners. And a lot of what I see is brain fog, fatigue, lack of exercise endurance, searching for words, so not blatant injury, but these like, why all of a sudden I used to be able to run 5 miles, now I can only run 2, and I start getting a racing heart. And in the work that I do, I listen to some of the, frontline COVID care folks, those docs, and I would help through their protocols, getting my people to have access to them. And many of the folks that were dealing with the low-key stuff, that really helped clear them up, and it sort of got them to question what's going on. Others, I haven't been able to help so much. It was too severe, and they're working with other professionals to try to get severe neuropathy. One person I'm thinking of has such severe pain, it's like his skin, it's a nervous system thing. A young kid, athlete, getting chest pain and anxiety while he's practicing. And once we use the protocols that I've learned from like Dr. Henry Ely, Peter Corey, all these guys, I see the results. So as a chiropractor, I don't really have a test I can run to show I know this is from spike proteins and from the vaccines. But when I employ the protocols that the doctors I study under are suggesting for clearing these things, I'm seeing results. So, and these people were healthy before, and so.
And what kind of thing are you suggesting? And we're not giving medical advice out here, people. We're just chatting.
I'll just be vague about what you would do to achieve this, but what I have seen hands down is you sort of have to clear the liver, thin the bile and clear the liver, cleanse lymph, and get inflammation out of the blood vessels. So it's a matter of detox pathways open, getting circulation improved, and getting lymph movement improved, and people can start to move these toxins out of their body. How you do that is different for each person, but there is a fairly consistent protocol that I would point people to other resources to get, because we don't want to give advice today.
No, we do not want to give advice.
No, thank you.
No, we do not. So what's your conclusion then? I mean, it's extraordinary to me that people still think it's okay. I spoke to a family member, let's put it that way, who's off to get their COVID shot and their flu shot in the same day.
I know.
So we're not really, we've got our communities bigger and reinforcements have arrived, but we're not really getting to the masses, I don't think.
No. It's so unfortunate. Part of what I wish I could have an effect on would be, I guess it gets simple. It comes down to informed consent, because you can't inform people about the dangers of something if you don't have all the data. My conclusion, though, like you asked me, I would say not everybody had a terrible reaction as far as I could tell, but I would say, I'm going to say 30% of my practice, probably 70% of my practice chose to vaccinate. I'd say of those, 20% had issues that were disrupting their lives. And I'd say another chunk of those people were just not performing well. And I guess what I understand from the dockside study under and what I've seen with my own eyes, the spike protein is a part of this COVID-19 virus or whatever it is, and times a bazillion when you're getting the shots, because we have way more of those spike proteins coming into our bodies when we get the shots. It's a huge inflammatory response. I think when it's coming in through the arm, it can get into the bloodstream and go wherever it likes. It can cross the blood-brain barrier, as opposed to when we breathe in the virus and we have our upper respiratory immune system kick in. And if you're in trouble and your body's not handling it, there are protocols, which brings me to the next thing. The rage I've had watching the lack of accessibility to the treatment protocols that I've seen with my own eyes working on people. But there's so many people that don't know about it, and there's a lot of shaming and humiliating if you try to talk about what you're seeing as a protocol that has worked very well. Super irritated with our Department of Health and the different places that should actually be including this information.
And remdesivir, the remdesivir deaths are out of control.
It's right in the study from H1N1, they pulled it because it was causing kidney damage. So, yeah, it's upsetting. And it's, the other thing I would mention, the mental health issues are off the charts. And I have friends who are therapists who are just flat out, they don't know how to help because there's not enough. They have to not return phone calls. Young people who are so afraid, the isolation. It's getting a little less now because we're sort of in this phase of like, it's not as up in our face, but I'm wondering what's going to happen as every year we come back from the summer and everyone gets sick with colds and flus, because it's what's happening when we bring our microbiomes back together. But we have this fear experience we've had that I think is going to layer over the top of a natural experience of people getting sick in the fall. And I'm switching subjects, but I want to go back to the kids, because I've seen children not wanting to go to school. They're still afraid. And one mom told me a story. She couldn't get her 2 little girls. It would take her an hour or 2 to get their masks off while they were home, once they were home from school, because they were so afraid that they were going to either be harmed or harm someone based on what was being said to them at school. So, what are we doing?
And that's terrible.
Natural immunity is a thing. And I feel excited because now we've got data. It's been a number of years. We've got world-renowned people at the top of their expertise, doctors and lawyers that are out there bringing the data, Children's Health Defense. Everybody's kind of bringing it into the light. And I'm seeing more people kind of cock their head a little bit like, I'm going to think about this for a second. Less quick to jump in and just do it out of fear and the way they coerced with all the language of do your part and all that stuff. So even though it's been hard and fatiguing to hold all the stories and try to be helping while I'm being ridiculed, and I've had to keep it to myself quite a bit, and also walk a line between the people in my practice, because I respect those who chose. I'm here to help if I can. So it's been a lot of biting my tongue. But at this time, I've never seen more people looking at these issues, and that is just that's a beautiful part. I'm so glad to be here at this time while this is coming up, and try to help bring it to a place where we can work together. I don't really like us and them conversations. It's hard not to go there, though, when I see people that I care about very much being hurt.
What do you know about shedding?
I witness it.
Have you experienced it?
Yes. I ask people to not come in my office for 3 weeks after they choose to get a shot, because I started not feeling well, and some of my staff as well. And And I was hearing from Dr. McCullough and Pierre Corey and people like that talking about shedding. I was like, oh. So I went and read the Pfizer's safety and efficacy study that talked about, they were really referring to pregnancy at that time, that if a woman were to have an adverse reaction to, they called it the intervention therapy, they wouldn't even call it the vaccine, they could be exposed to it by inhalation or skin contact. So I was like, oh, that might be what's happening. So we started using the protocols and asking people not to come in so soon. And I've had, I'm going to say 5 or 6 patients who are massage therapists who've gotten very ill. A lot of uterine issues. I don't get to say this as a truth, but I have questions about the uptick in cancer in my office, and some of them very fast moving, and who doesn't know somebody? It's like all of a sudden everybody's talking about that. So back to the shedding though, it seems really evident to me. I have young kids coming in who are not vaxxed, but they're in a classroom of vaxxed, and they have symptoms that are like the folks that have gotten them, and so we run the protocols and they improve. So I don't have blood labs and I don't have, statistics like that, but I have clinical data of seeing the symptoms look the same, running the protocols that seem to be helpful, and thinking, wow, it happens to this child every time she comes home from daycare. She only goes twice a week. She's home for the weekend, she's good. She goes back, she comes home after, and she starts having fevers and can't sleep and is real irritable.
And this vertigo, lots of people feeling so dizzy.
Yeah, inner ear congestion, I think. You know what I think? I don't know if this is true, but I feel like because the spikes are so inflammatory and they start to mess with the circulation, then the liver starts to get a little involved, then the lymph gets involved. And so you have this kind of stagnation of lymph and circulation movement of the upper respiratory. So inner ear, which is where a lot of vertigo and ear ringing can happen, brain fog. So if you can get those downstream detox pathways open and use some of the protocols that are there, this seems to be able to drop and start to bring in some relief.
Where can people follow you, contact you, see what you're doing? Is there any website or?
Sure. I mean, they could go to my practice, I guess. It's Cedarwood Natural Health Center. It's just cedarwoodnaturalhealthcenter.com. Yeah. I'm hesitating because we're so busy. I'm like, oh God.
But please don't really come because we can't handle it.
Yeah, no. No, I love educating people, and I'm not attached to if they pick up what I lay out. My thing is they're only hearing one side of the story. And why all of a sudden all these tests that are being run by the medical docs to try and understand their mystery disease? All the labs are good. Why am I not okay? And so I like being able to bring in people into the methods that we use and help them see, is this what's happening? And if it is, what can you do about it?
Is there anything else you want to tell the people?
Remember, your body is amazing. It knows how to heal. Your immune system is pristine. Primarily, the only reason it wouldn't be kicking it in most incidences is something's in its way. So it's about clean food, clean water, access to functional health care, and get more data, open up a little bit, and look at more angles before you make your choices. I'm seeing too many negative outcomes without enough payoff, the risk payoff piece. So I would say just be careful.
Very careful. Okay, well, thank you so much for your words of wisdom and for all you do.
Oh, thank you.
I really appreciate it.